I'm just wondering, come and stand here. It's probably easier. Sorry, I'm going to mess this up for you. But come and stand here, because I just think you can appreciate things a lot better live. The majority of you can see her, right? Yes? Quite clearly. Yes? Yeah, you don't need the camera.
Okay, we don't need
it doesn't matter. Okay. So, you know, when... no, I know you can't see at the moment. Okay, so this is a very young lady. She's never been injected before. These are her own lips, so she's very naturally very blessed to have these lips. I think you said you were 24 years old. Is that right? Okay. So, you remember I spoke to you about what is the first impression? When someone walks into the room, you are struck by what it is that you see, okay? Now, what I see for this lady immediately, and I have discussed this with her, so she's not going to start crying when I say, oh, you need this, is that she has a beautiful mid-face, okay, very broad. The bizygomatic diameter is very broad, it's fantastic. The immediate impression I get, and I hope as aesthetic physicians you also see the same thing, is this lower third. Okay, this lower third, relative to her mid-third and upper third, looks a little bit as if there's not quite the right harmony. Okay, there's not quite the right balance and proportions. So this is the first area. You know, we spoke about beautification. So this is a naturally very beautiful lady. So, but how can we improve her aesthetic score? How can we beautify her even more? How can we enhance her even more? So let's just have a look at you in profile like this, and hopefully once again you can get an impression that, for me, this angle is a little bit too sharp, okay? And she needs a little bit of projection of the chin, and maybe even a little bit of elongation of the chin. Because if we think about the rule of thirds, she has a nice upper third, a nice lower. Sorry. You want to do the profile on the camera? Okay.
This angle is
this way? Where are you?
Yes, yes.
Where are you?
That's it.
Okay.
That's it.
Okay. That's it. And if we can just turn you this way, this will help you. That's beautiful. And just, that's it. That's it. So can you see there? And this is relative to, I'm not a dentist, so I'm probably going to use the wrong terms, okay? But she has a little bit of overbite. Show me your teeth. Show me teeth. Yeah, you can see she has a little bit of overbite, okay? And this is giving you the impression that the chin is sitting back a little bit. So if we can enhance the chin, and this is the angle that I'm talking about. For me, this angle is too sharp. It would be better if it was opened a little bit, and if we elongated and projected the chin. So if you remember, we want to enhance here, okay? We want to project. So we want something with a high G prime. Just realize this must be perfect. So I'm so sorry. Carry on.
Okay.
Yes.
تنشوف بهيدا البيشنت انه عمرها 24، يعني ما خسرت ولا شيء، ولا من الدهن ولا من شيء، يعني بوجهها كلها حلوه، عم بيقولوا ان هي حلوه، بس اذا هون بدنا نطلع على 3 اقسام الوجه، العالي والنص والواطي. اول ما تفوت بتشوفوا انها هي كثير حلوه، بس بتحسوا انه البارت الواطي عندها شوي لورا، فنحن بدنا نحسن الشكل، ما في شيء خسرته عم نعوضه مع العمر. هون بدنا نستعمل شيء ليكبر لها الدقن ويقدم لها اياه شوي لقدام، تا شوي يصير عندها البارت التحت متوازن مع البارت اللي فوق. شو برأيكم؟ مش صح؟
Okay, so one of the other things that I was struck by, I know you're seeing in profile here, but we'll turn around in just a moment, is that because she is blessed with these beautiful cheekbones, what happens either side of those cheekbones? Okay, sometimes what can happen is that you have a little bit of a concavity here. Okay, so if we can turn you to the camera, you can probably see. You see? The concavities come here. And this is, once again, it's a relative thing because of her high cheekbones. So, to give her a nicer oval-shaped face, to change and alter the way the light hits the face in this area particularly, we want to give her some volume here. Okay, so we're going to use Resylane volume. So once again, 3 degrees of cross-linking, so it has the ability to lift. You remember the Millennium Dome, or the O2 Arena it's called now. It has the ability to lift, but it also wants to spread as well. So we're going to use a single injection point technique, deep onto bone, and you will see how we affect this shadow here, and also on her left-hand side as well. Okay, so those are our 2 main areas, and yes, go for it. Yeah.
اوكي سو هون اذا كمان بنشوف هون حد التمبلز بتشوفوا شوي انه مخسوف، يعني ليش؟ لانه عندها التشيك بونز اللي هي الوجه العظمه تبعها بارزه كثير، عم تخلي انه الضوء يضرب اكثر على الوجه اكثر من التمبلز هون، سو بدنا نعبيهم. بدنا برودكت بينتشر لانه هيدي المنطقه بدها برودكت سهل وبينتشر، بس كمان بذات الوقت بده كمان يعطي شويه ليفتنج. سو اذا بتتذكروا الميلانيوم دوم عندنا البرودكت اسمه فوليوم بينتشر وبذات الوقت بيعلي المنطقه هون.
Yeah, so the assessing of the face is probably the most important thing. She may have come in, oh doctor, I want some toxin for my glabella or something like this. Is not, she doesn't need toxin. This is the typical, because this is what patients know, this is all they know. Oh, I want to improve this. Okay, but it's up to you as aesthetic physicians to think about a much more 3-dimensional, holistic way of doing things. Okay, so you want to pop yourself on the couch, my dear? And now whoever's working the camera, if you can do that, that's fantastic, thank you. Okay, so, we okay? Because I need you to be able to rest your head back. Okay, is that okay? Yeah? And then your chin down a little bit. Are you okay? Fine. Just worry that. You can lower the camera there. Okay. So I'm just going to cleanse the area to begin with. This is just cold and wet. Okay. Just with some alcohol. Okay. So we have to think about the anatomy, and we have to think about safety. You got a pencil? Yeah. So Tanya will translate as I'm kind of talking. So what I'm going to do is mark the temporal crest, which will just come in here. This is the temporal bone coming in here, and you can see where this just changes, and it coincides with the lateral part of her brow. I'm going to mark her zygoma. Okay. Good.
I think this
Okay. That's fine. Okay.
doesn't.
And that's fine. And so then what we're going to do is, in terms of safety, the one thing we need to worry about is the superficial temporal artery. Okay. So we're just going to palpate. That normally does sit in the hairline, but very occasionally you can get the odd patient where you get a little anomaly and it comes into the area that we're looking to inject. So I'm just making sure that this is perfectly. Yeah, that's fine. Yes. Okay, so that's perfectly fine. So the temporal, superficial temporal artery actually runs rightly along her hairline, which is what we normally expect. So I don't need to mark it in this case, because I know the place that I'm going to inject is going to be 1 centimeter up and 1 centimeter down into this hollow here. Okay? Okay, into this hollow here.
It should be fixed.
Okay.
It should be fixed.
Okay, so yes. So what I'm going to do is inject in an area that is, yeah, it's probably best on the tripod. You
Yes.
Yeah, I think it's best on the tripod, just because of
لأنه
the,
هي عم
yeah.
تقول لي
So many of you can probably see, hopefully, the slides. 1 centimeter back and 1 centimeter down from this line will give me this area of hollow here, and that's going to be my injection point. I check to make sure that the superficial temporal artery is not sitting into this area, and that's very important. Okay. 27. Okay. Yes, of course. Of course. Yeah, no problem. Good. So we're going to use Resylane volume. Okay. You're good. It's not. No, you'll feel a little bit. So it's important when you're injecting the temple area, particularly, that you advise patients that that's probably better.
Yeah.
Yeah. Is that better? Do you see? Yeah. Fantastic. Sorry about that, guys. It's taken so long just to get it just perfect for you. So. Essentially, what we're looking to do is inject in a single point entry point technique. Okay, just in case you had missed it, 1 centimeter up and then 1 centimeter down. Some of you may have seen this technique with Arthur Swift.